Zach Holdsworth came all the way from a New Zealand farm to help reform the US healthcare system. At Hint Health, he's enabling a direct care model that frees mostly primary care practices up from overheads, hassles, and misaligned incentives that characterize third party reimbursement. In his view, health insurance should pay only for the occasional, unpredictable, and expensive occurrences, and it shouldn't be the default payment for predictable care. Hint handles about $500 million of payments right now, and it's developing new tools to enable innovative approaches by health plans and employers. I'm David Williams, host of the Health Biz podcast and president of Health Business Group, a strategy consulting firm that helps companies like Hint Health to develop robust growth plans. Reach out to me, dwilliams at healthbusinessgroup.com, if you'd like to discuss strategy for your company. Finally, please do me a favor and subscribe to the Health Biz podcast. Zach, it is a real pleasure, and I want to talk a little bit about your background, your upbringing, any childhood influences that we should know about that helped to get you where you are today.
Yeah, I mean, I think my journey started off. I grew up on a farm in New Zealand, and still to this day, kind of visit home. And I'm actually right now at home trying to escape. Came back to escape COVID, but
Zach, you either have to be a billionaire or from there in order to make that happen. Is that right?
that's right. Yeah, exactly. So I'm from there exactly. And I think that a big influence on me was my dad was an engineer by training, and but also a farmer, and so he kind of had a farm, but also had a business on the side, which sort of manufacturing type company. And I kind of got the entrepreneurial bug from a young age. And also, in addition to that, my dad got the first computer in town, in our little town. And so ever since that moment, I think I wanted to go to Silicon Valley. And so went through engineering school, had a career as an engineer and then a consultant. Eventually, kind of made my way to, I kind of was lucky enough to get into Stanford, where I did my MBA. And that was kind of my moment. I was like, okay, I always wanted to go to Silicon Valley, so I'm going to go to
Yeah.
Stanford and kind of break my way in. So kind of fast forward to today, and that's kind of where I am today.
Zach, are you seeing like back in New Zealand, are you seeing like your friends from early days? Did they all have the same idea and head off to Stanford as well, or what are they up to?
No, it's interesting. I'd say I've been away so long from my hometown that a lot of my friends actually aren't here anymore. And many of them kind of went off all over the place. And I kind of, in a way, lost touch with a lot of them. But a few of them are still here. One of my friends actually is back in 20 years ago or so started what is now the largest music festival in New Zealand called Rhythm and Vines. So I was like at the first one of those, and so there's one of my friends who's still running
Yeah.
that festival. And so yeah, unless it's shut down by COVID, I'll be there in a few months.
No, that sounds good, Zach. Well, I know it may throw you off with that question, but it just occurred to me there. So, as people that come from outside the U.S., there's a lot of kind of acclimatizing that you do when you arrive. But one thing that people from elsewhere don't usually ever get used to is the U.S. healthcare system. I know my wife is from Canada, and she was always terrified by it, and still is, even though she's with a healthcare person here for many years. And I thought I saw at one point that you said, of all the different things you could do over at Stanford and beyond, dealing with the U.S. healthcare system wasn't going to be one of them. Did I read that right? And if so, what got you actually working in healthcare?
Yeah, I mean, I think I'd always kind of looked at the healthcare system and thought it's so bureaucratic and broken. It seemed that I was like, I was almost sort of didn't know where to start. Um, so I think it was more just daunting, if anything. And I like to make change. I like to change things and make things better. And I thought I wouldn't be able to succeed. So there is the thing I think that got me into healthcare is at the time I was really in, to a certain extent still, but much lesser extent, I was into, you know, my own personal health and how to optimize my own nutrition and sleep and all of the sort of this quantified self movement, guess. So I got pretty heavy into that. But then, I was basically a kind of an analyst at a VC firm, and we did a deal in a company called Wellness FX. It was basically the first direct consumer clinical diagnostics company. with a telemedicine sort of offering attached to it, and licensed in 48 states or something like that. And so I got really excited about that through the lens of this is a kind of this is an opportunity to actually get into something that I'm really interested in personally, but also start to look at the healthcare system in a way that's more manageable. So it's at Wellness Effects that I actually got really interested in transformational things that you could do within the healthcare system to transform US healthcare more fundamentally. But I sort of edged my way into it through a more of a passion of mine that was adjacent, really. Because, yeah.
Great. Well, Zach, you gave me a little bit of a hint about Hint by talking about how you saw the system as being very bureaucratic, because you're working on something at Hint that is related to direct primary care. Now, what is it that makes it primary care direct, and how does it relate to other kinds of primary care?
Yeah, the thing that differentiates direct primary care and really direct care generally is tradition. For the most part, the majority of payments in the US healthcare system are kind of managed and administrated through the kind of legacy fee-for-service infrastructure, insurance fee-for-service infrastructure. You may not be, it may not be insurance that is actually provisioning the payment, right? But the infrastructure that insurance companies have built is what is leveraged to handle payments uh, and really essentially covers the majority of healthcare spend. With a direct primary care type model, and this of course creates a bunch of perverse incentives, it introduces overheads, massive overheads, and also eliminates price transparency, which are kind of the way I tend to think about the fundamental reasons why the healthcare system is broken. So with a direct primary care model, what you're doing is you're stepping outside that traditional fee-for-service model, and you're contracting as an individual or an employer directly with the provider. And instead of submitting a claim, they'll have a fixed monthly fee for essentially unlimited access to primary care, telemedicine, urgent care. But it's a price transparent, pre-negotiated rate, and you pay the doctor directly, and they will deliver those services. And so you're eliminating all that legacy infrastructure and replacing it with a very simple, intuitive payment model that works for all of the parties involved. So that's direct primary care. And if we have to talk about what we mean by direct care, but that's kind of where we started as a business,
Got
supporting
it.
this growing, emerging ecosystem.
Now, there are other people that have tackled primary care from different angles. And, a concierge care would be one example. There's some kind of online first or digital first approaches. How do you
Mhm.
fit into that universe, or do you kind of overlap with it?
Yeah, I'd say we overlap with it. We power a lot of the leading concierge groups in the nation. We power a lot of our platform's a membership management billing payments platform. So we are handling a lot, close to $500 million a year of basically payments in that realm. So we power a lot of those entities. We also power a bunch of virtual first care models, right? The thing that I'd say is common across our customer base is that whether it be virtual first care, direct primary care, or concierge care, the thing that is common, the common thread is that our clients are, for the most part, not billing insurance, right? They're going direct. So if you have let's say you have a virtual first model, you may have an employer that is paying for that, and they're paying, let's say, a fixed PMPM. Our infrastructure is powering those relationships. And we see the common thread, though, is that there's no insurance billing, and there's typically a pre-negotiated rate, which is understood up front, and it's a contract between two entities without a third party that's in the middle of it.
So some concierge practices, for example, do bill insurance in addition to charging a fee, and you wouldn't necessarily be working with them, or would somebody who's also participating on fee for service use Hint for the direct part of their business?
Yeah, so in the instance where we have, say, a concierge group that is also billing insurance, we will say One Medical is a good example, right? You have a membership fee and then you bill for the fee for service component for insurance. We have clients that do that. It's not the majority of our customer base, but we do have clients that do that, and they just leverage Hint for the direct piece of that. We don't bill, we won't handle the insurance component. And so it's not our main custom segment, but we do have tools that are useful to that segment. And and it's interesting, actually. One of the things we're starting to see is a little bit of an evolution happening with entities that have that model, but their employers are actually coming to them saying, hey, could you actually offer essentially a direct primary care model whereby we'll pay you a fixed PMPM or a cash rate for services that fall outside that PMPM and don't bill insurance? Can we just do the whole thing through a direct contract? So we're starting to see that trend happening a little bit with groups that have that more concierge type model where they will
Yeah.
continue to bill insurance as well as membership fee.
It's interesting because obviously it gets pretty complicated if you're dealing with kind of more than one business model, but it sounds like something you work your way into. Now, Zach, you mentioned earlier on in the interview, I said direct primary care, and certainly a lot of your business is primary care, but it seems as though it may not just be primary care. And, how does this fit sort of, beyond primary care? Or is it sort of primary care and then there's a couple of exceptions? Or, what's the vision for direct care?
Yeah, so the vision for direct care is, the way we tend to think about kind of transforming healthcare is there's no functioning system in the world, that a healthcare system in the world, that doesn't have a highly functioning primary care system. So that's why we started with direct primary care. There are things that we can do to help support the growth and success of this movement. And the way I tend to think about it is direct care is the same principles of price transparency, making sure there's natural incentive alignment or lack of perverse incentives, and also just low administrative overhead. You can apply those same principles to things that fall outside the four walls of primary care. So the way I tend to think about direct care and the vision for where we want to head as a business and the transformation we think is necessary to transform US healthcare is enabling an ecosystem of transparently priced direct pay relationships that are grounded in a foundation of affordable primary care. So common, predictable care is moved outside from under the insurance umbrella, leaving just unpredictable, high-impact incidents in the insurance arena. So we don't have I'm not against insurance per se. I just don't think that insurance should be the mechanism with which we spend, we pay for 60, 70, 80, 90% of all healthcare. That doesn't make sense to me. So we leave insurance for the unpredictable high impact incidents, and everything else could fall under a direct care umbrella, which would eliminate lots of costs and make a much better experience for everyone and be just a better overall system. So that's how we think about direct care.
So I don't know if it's a fair analogy, but say if I'm driving my car and I would pay cash for gas and oil change and maybe the occasional tune-up, but if I crash the car into a building or if I hit somebody or like somebody who hit me a few years ago, then the insurance part of it comes in. Then it's worth it. Then it's unexpected. I can't budget for it, and it's worth the bureaucracy to go through it. Is that fair?
That's right. Yeah, when you total your car, it's actually quite annoying dealing with the insurance company, and they make it hard, as they should, right? To get your claims processed. But if you have a legit accident, you'll get paid. And you'll probably have the police show up, and there'll be a police report, and there'll be a bunch of overhead and administrative overhead that's necessary in order to secure the insurance business, right? So that they're able to actually take on this risk, ensuring that there isn't fraud and things like that. But if you had that process in place for replacing the oil, right? Or even I would argue if you had the back small corner window is smashed, right, by someone breaks in and it's like $100 to replace it. Having all that infrastructure in place to replace that broken window or replace the oil, which might $100 or something like that, doesn't make any sense. And that's the same in healthcare, right? We know that there's common predictable care like primary care, right? We know things like that. We know that things like imaging need to happen on occasion, and they don't need to be thousands of dollars. They can be hundreds or even less than $100. So can we move all of that outside of this really hefty, bloated infrastructure? And yeah, it's more similar to car insurance. It's actually a really good analogy.
So it's interesting you're describing kind of common predictable care and then the rest, as opposed to strictly primary care and specialty. Because if I think about primary care, you look at a doctor's office and it's set up with insurance like you're describing, and they're filing this claim, and maybe they're going to get paid $50 by the insurance company. They're going to be told to collect $50 from the patient, and they spent $25 or $30 to get that. That clearly, that doesn't make a lot of sense. But the primary care, at least in Boston, is really just a few percent of the total cost of care. So even if you deal with that, yes, people are dealing with that every day, but you haven't really addressed kind of the cost problem. And there's a lot of patients, and I don't have the exact breakdown, but let's say somebody with a chronic illness, which is a lot of people, and they may be on a fairly expensive medication, and their care may be predictable, and it may be fairly expensive. Maybe tens of
Mhm.
thousands a year, not hundreds of thousands, but 10, 20, $50,000 a year is not uncommon. Are you saying that
Yep.
this kind of direct approach has a role there as well? I mean, because it's predictable, but it is expensive. How does it
Mhm.
fit in there? Because that's what
Yeah.
I think about where a lot of the cost is that you can predict, but you can't necessarily do that much about today.
Yeah, so maybe just addressing the first point you made, which is, primary care is a really low percentage of care, right? And I actually see that as part of the problem. A lot of those things that you mentioned, many of them can be managed, not all, but many of them can actually be managed fairly well within a primary care setting. Certainly urgent care, right? Certainly, a large majority of ER visits, right? Not all, obviously, but a lot of ER could be handled within a primary care setting if it's set up properly. And a lot of the things that end up, tens of thousands of dollars, right, are things like diabetes. A lot of those can actually be managed when you're pre-diabetic within the primary care setting. So the one argument I make is I think we need to expand the scope of primary care. One of the in the case of you know I lost my train of thought. Yeah, so the a lot of those what I'm advocating for is expanding the scope of primary care. And we're
Yeah,
actually seeing some groups saying, hey, why don't we integrate mental health? Why don't we start to bring in some specialist care within the four walls of primary care? Other things we expand scope. But then the things that are common, predictable things that are known ahead of time, the the way I tend to think about it is there'll be a point in time where yes, you want insurance, but it shouldn't be the default method, right? I'll give you an example. There are some surgeries that cost $1,000 or a few $1,000s, right? And there are some people that have car insurance where their deductible is a few $1,000s, and if they need to redo some panel beating, they'll pay out of pocket for it because they realize that the premiums for insurance is much higher. So the default is pay cash and then insure the stuff you can't afford. The default in the US healthcare system is the opposite. Everything's insurance, and then okay, maybe I'll pay cash for my direct primary care, right? Maybe. So what I'm advocating for is let's have the default be a pre-negotiated price transparent rate for any set of services that in theory could be paid for through cash, and then layer insurance on top of that. And then you can choose. Like we're talking long term here, right? We're not talking like next year, but then
yeah,
you
I
can
got it.
choose where you wanna like at what level do you want to do you want to insure this stuff? And I would argue that if you're able to save, if the average family spends is the cost of healthcare for the average family is $20,000-$30,000 a year or whatever it is, if you were able to make that ten or $15,000 a year, then you've got $15,000 to $20,000 a year of spare money that is just pooling there, which you could pay cash for stuff. Now, obviously, it doesn't. It's not a perfect analogy, but I just think we need to change the default mindset in healthcare. Everyone always thinks, okay, how do we get the reimbursement pathways in place for insurance? Because that's where the money is. And I'm advocating we need to change the system.
Good. Well, it is a big ambition and something that it will keep you busy for some period of time. Let's talk a little bit more about what Hint actually does. What's your role in it, and how do you avoid becoming just another middleman among many middlemen that
Mhm.
are in the U.S. healthcare system?
Yeah, yeah. So we're the membership management and billing infrastructure for these direct primary care or direct care models. We handle everything from membership management through to if you're dealing with an employer, we've got pretty powerful direct contracting infrastructure, so you can manage your enrollment and eligibility management, all your employer billing. We've got quite sophisticated plan administration rules engines where you can actually define what's included in a plan. And in a way, think of it as like effectively you're taking the administrative health power of a health plan and giving it to the provider, so they can actually effectively adjudicate their own rules around what's included in their plan. And so that infrastructure is all supports as you scale to larger and larger employer contracts. We also, and I mentioned we're putting probably close to half a billion, half a billion or so a year of payments through our platform. So there's also a
Yeah.
payments component. Um, but then, in addition to that, we also have networks that are running on Hint as well. So what's really interesting is we're starting to see really interesting models form whereby I may have my own, say, bricks and mortar clinics for Colorado, but I don't have clinics in Florida. So I'm going to actually affiliate with someone that does has clinics in Florida, and our infrastructure can help power that relationship and that network. So when an employee selects this plan, chooses this doctor who happens to be in Florida through the network, our infrastructure can kind of help power that entire chain. The way I tend to think about it is we're a technology enabler to the providers that are out there changing the game. We're not necessarily a middleman just because by nature of it, we're just streamlining the existing processes with which these entities are running their businesses. And we don't get in the middle. It's not our relationship, right? It's the relationship of the groups we're powering, and we just think of it as like just the same as you would buy a CRM for your sales force. Well, you're buying a billing and enrollment eligibility system for your operations team to scale their operations.
So Zach, what's on the product roadmap? I know you're having a Hint Summit coming up. I don't know if you're going to be talking about any new things that are coming, but what can we expect?
Yeah, so some exciting things coming down the pipe. I'd say just lots of kind of more features we're building and launching. But I'd say on a strategic level, probably the two primary things that we're bringing to market. The first of them is more tools to support more and more sophisticated plans. So that's kind of coming out soon, and that's really been pushed there by our larger clients with large employer contracts. The other thing that we're bringing out is we have a number of really innovative health plans and kind of networks and groups that are wanting to integrate these types of models into what they're doing. And so we're bringing a product out called Hint Connect that makes it really easy to quickly connect and contract with our customers, so that they can put their hand up and say, I'm willing to take lives at this rate. These are the services I provide. Make it really easy for them to get plugged into these various different innovative networks and innovative health plans that are trying to integrate direct primary care. That's the second big thing. I'll be actually announcing that at Hint Summit. So hopefully your podcast doesn't come out until after Hint
Yeah, it'll
Summit.
come. Well, now
Um,
now that you mention it, maybe I'll speed it up. But no, it's scheduled for after the summit.
yeah, okay, great. And then the third piece actually is we're starting to help our clients manage their downstream cash-based networks, right? So this is a 2022 initiative, but we'll be enabling our clients to start to really administer their direct care networks and their direct care relationships beyond the four walls of primary care. And that's how we want to play a role in expanding this ecosystem beyond primary care.
Great. Well, Zach, I admire you for making the long journey from abroad in order to help us out here in the U.S. healthcare system. We certainly need it. You bring a good, fresh energy, and I'm glad that Hint is making its way through and enabling some of these more innovative models to go forward. So, congratulations so far, and good luck on your next steps on that.
Thank you very much. I appreciate it. No, it's a long. We're in it for the long haul. I don't think that you can transform an industry in 4 years, right? It
Yeah, not
takes
that.
decades, and so
Yeah.
that's the way we're signed up for that, right? We're going to change the system, one step at a time.
Now, Zach, any books that you recommend? Anything you've had time to read lately, or anything that you would recommend specifically for our viewers and listeners?
Oh, that's a tough one. It's funny. I actually most of my reading is sci-fi and sci-fi and kind of techno thrillers. Um,
Yeah,
I'd say
we allow
so.
that.
Yeah, I haven't read too many business books recently. I kind of, one of
That's
the
okay.
books that I'd say what was powerful for me in the early days of Hint was a book called Lean Analytics. I thought that was like quite a good book, and just sort of thinking through how do you evolve the key performance metrics that are important to your business at the stage you're in your business. and how those evolve over time, and how you should think through really essentially choosing what you're measuring, because what you measure you'll sort of try to change, and you can actually measure the wrong things and go in the wrong direction, right, with those incentives that come from measurement. So I thought it was a really interesting book. I've got sort of, yeah, there's lots, and then I'd say if I was to pick the sci-fi book I've enjoyed most recently would probably be Dark Forest, the Dark Forest from the Three Body Problems author. So it's a sequel to Three Body Problems. That's really good.
So Zach Holdsworth, co-founder and CEO of Hint Health, thank you so much for joining me today on the Health Biz Podcast.
Thanks for having me. It's been great to connect.
You've been listening to the Health Biz Podcast with me, David Williams, president of Health Business Group. I conduct in-depth interviews with leaders in healthcare business and policy. If you like what you hear, go ahead and subscribe on your favorite service. While you're at it, go ahead and subscribe on your second and third favorite services as well. There's more good stuff to come, and you won't want to miss an episode. If your organization is seeking strategy consulting services in healthcare, check out our website, healthbusinessgroup.com.